Thank you. Honorable members, before we proceed, I would like to remind you that the visual mini plenary is deemed to be in the precinct of Parliament and constitute a meeting of the National Assembly for debating purposes only. In addition to the rule of the visual sittings, the rules of the National Assembly, including the rules of debate, apply. Members enjoy the same powers and privileges that apply in a sitting of the National Assembly. Members should equally note that anything said in the visual platform is deemed to have been said to the House and may be ruled upon. All members who have logged in shall be considered to be present and are requested to mute their microphones and only unmute when recognized to speak. This is because the mics are very sensitive and will pick up noise which might disturb the attention of other members. When recognized to speak, please unmute your microphone and connect your video. Members may make use of the icons on the bar at the bottom of their screens, which has an option that allows a member to put up his or her hand to raise points of order. The Secretariat will assist in alerting the chairperson to members requesting to speak. When using the visual system, members are urged to refrain or desist from unnecessary points of order or interjections. Honorable members, we shall now proceed to the order, which is debate on vote number 18, Health Adjustments Appropriation Bill. I now recognize the Honorable Minister of Health, Dr. Zweli Mkhize.
Thank you very much, Honorable House Chairperson, honorable members, Chairperson of the Portfolio Committee, members of the Provincial Executive Councils and members of the boards of health entities, and members of academic research meetings and officials, German South Africans. We present the Department of Health's adjusted budget vote and policy statement at a time that's unprecedented in the history of modern society. Last year in September, the world convened at the 73rd session of the United Nations General Assembly to commit to the ideals of achieving universal health coverage by 2030 through the high-level meeting on universal health coverage. At the time, no one could have predicted that barely 4 months later, the COVID-19 pandemic would literally bring the world to a standstill, shake our healthcare system at the very foundation, and demand the acceleration of healthcare reforms. Before this pandemic descended on our shores, we're building a road towards universal health coverage through our democratic process of deliberating the National Health Insurance Bill. In his State of the Nation address earlier this year, His Excellency President Cyril Ramaphosa reiterated the purpose of the NHI by stating that, and I quote, "It's a fundamental condition for growth and development is a healthy and productive population with access to quality and affordable health care," of quote. We continue to put great effort into improving health service delivery and prepare NHI to achieve universal health coverage. Honorable House Chairperson, COVID-19 has illustrated just how important data and information are in managing health decisions. We're pleased that during the past few months, the NHI information system capacity has been augmented, strengthened, and dramatically improved. Investments made in these improvements will all remain and enhance the capability of the department to manage the health system into the future. We've established a patient registry through the deployment of the health patient registration system in our primary health care facilities and hospitals. And to date, 51,909,554 patients have been registered. In addition, we have also developed a health systems dashboard, which will very soon go live. This system will support government with early warning signs in surveilling hospital infrastructure, alerting us to impending critical mass reach in various areas of our operations, and giving us an opportunity to respond before there is a crisis on the ground. One of the NTP's implementation goals is to build health infrastructure for effective service delivery. The department has developed a 10-year national health infrastructure plan to improve health facilities, to ensure construction of appropriate health facilities on a sustainable basis. Healthcare infrastructure will focus on the provision of new hospitals, community health centers, clinics, and maintenance and upgrading of established facilities that need to be expedited to improve citizens' access to more advanced healthcare facilities. The department has also prepared a proposal for resolving health infrastructure backlogs and preparation for NHI. This proposal will also play a significant role in job creation and stimulating economic growth and transformation of the construction sector. We believe that this health infrastructure program will improve public confidence in the public healthcare system, improve the morale of the personnel, and better staff retention because of a safer clinical environment. We have now started engaging key stakeholders, including the National Treasury and DPSA, to develop strategies to accelerate the program. Prior to COVID-19, extensive consultations were already underway, even in the private sector, with potential investors and provinces. The health infrastructure commitment remains, and COVID-19 has taught us that the time waits for no man. If we are to achieve our infrastructure goals, we need to do so and with speed. Currently, a total of 20 hospitals and 34 primary healthcare facilities were revitalized, 7 primary healthcare facilities constructed, and 39 facilities refurbished. COVID-19 pandemic has also called for specific focus on the provision of additional ICU, high and high care space, isolation wards, and fever clinic with triage at existing hospitals. Provision of beds and emergency wards has also been prioritized either in existing facilities, hospitals being prepared in the country for the surge in COVID-19 patients that will require hospitalization. Oxygen systems and equipment to support them have also been procured. Linen and warm furniture has also been upgraded. This improvement in infrastructure will remain as improvement to the capacity of the healthcare system post-COVID-19. House Chairperson, as the globe, we have tipped now over 15 million mark over the COVID-19 confirmed cases. As a country today, we report 13,104 new cases. This gives us a total of 408 and 52 cumulative cases. We have publicly stated that the storm is upon us. This is evidenced by the surge in different provinces, namely the Western Cape, Eastern Cape, Gauteng. KwaZulu-Natal appears to be following the same trend. The reopening of the economy, which led to the movement of the people in the country, has, with no doubt, contributed to the rise in numbers. However, we're mindful that the government had to grapple between protecting our citizens' lives and their livelihoods. It has not all proven to be easy exercise, with various sectors having their own expectations, informed by challenges that they face. But we want to assure every South African that, inconvenient and uncomfortable as things may be, our intention is to do what is best in the interest of our people. The COVID-19 pandemic has indeed placed an unprecedented demand on the healthcare service delivery in our country. The recruitment of doctors, nurses, and other key professionals remain a priority during this period. We're pleased that between January to July 2020, a total of 2,547 medical interns, 8,624 community health service personnel were also allocated to statutory posts. It is further expected that a total of 3,050 medical interns and 7,389 community service personnel will be allocated in 2021. In the previous year, the National Treasury allocated funds through the HR capacitation grants for a total of 9,165 posts for all health categories to be filled. These posts were filled as part of the process to lift the moratorium on filling vacancies and to alleviate shortfalls of health professionals in the health sector, despite financial constraints in government. And the following is a breakdown of the posts. Statutory and critical posts was 5,517 in 2015. Community service 3,002. It includes doctors and nurses and other health professionals. Number of permanent posts filled was 3,648, which is again in the same divided on those categories. We can never overemphasize that health workers are the backbone of our fight against the pandemic. It is therefore in our interest not only to recruit them, but to take sufficient measures to ensure that they are protected in the performance of their duties. From as early as March 2020, National Treasury made an allocation to provincial health departments for the procurement of the personal protective equipment. This was further augmented by the generous donations from various South Africans, corporates, and society, also through the Solidarity Fund, and we have received donations from other governments across the world. For this, we are most grateful. It has indeed shown a true spirit of compatriotism. Honorable Chairperson, over the past couple of months, we've been hard at work on our 2020-2021 adjustment, scrutinizing every line item, reprioritizing for a rapidly changing environment. In this regard, the 2021 annual performance plan that we tabled earlier has been adjusted to consider the likely impact of COVID-19 on the health system. We're also mindful that while we focus on this fight against COVID-19, we have a responsibility to ensure that gains made to our fight against HIV and TB and other programs are sustained regardless of the COVID-19 pandemic. It therefore gives me pleasure to table the new baseline budget of 2020-2021 based on adjustment at 58.4 billion rands, with a total allocation of 5.5 billion rand earmarked for COVID-19. The reprioritization focal area includes our most urgent and pressing needs in the midst of the surge of the COVID-19 cases. I would like to give an update on the research and related activities in the country. The COVID-19 pandemic has motivated all of South Africa's health institutions to rethink, reorganize, and reshape their priorities and agenda. In this context, many of the South Africa's leading research institutions and senior researchers have forged new national and global research collaborations aimed at answering critical clinical questions of public health interest. Surveillance studies for COVID-19 were established early in the lockdown to monitor the trends of COVID-19 infections amongst the healthcare workers and pregnant women. New surveillance studies are being planned to investigate trends in infection in households, communities, outbreaks, and in various workplaces, such as mining industry. Other studies in the development aim to evaluate improved diagnostic tests for the detection of recent and past infection. In parallel, SAPRA and the NHLS have developed a novel strategy to evaluate the quality of serology and molecular tests, both of which are critical for the country's management and understanding of the evolving outbreak. There are many clinical trials in the planning and in the progress that aim to identify the new technologies for the prevention of COVID-19 infection. These include vaccine studies, pre-exposure prophylaxis studies, and studies aimed at evaluating new therapies for both early treatment and for later treatment of hospitalized patients. Other studies underway include establishment of pregnancy register to evaluate potential harm to pregnant women and their babies caused by COVID-19, and a number of qualitative studies exploring a socio-psychological impact of COVID-19 infection and the pandemic more generally in terms of social and mental well-being of South Africans. The health departments, entities, and statutory councils continue to play a vital role in supporting health services and improving the health of South Africans. The NICD received an additional grant of 96.7 million, and provinces were allocated 2.1 billion as part of the 3.4 billion conditional grant to pay NHLS for expanded COVID-19 testing services. In response to COVID-19, the NICD has played an important role in including providing epidemiological support provinces, developing and reviewing national guidelines and expanding death curve hospital surveillance system to monitor mortality and morbidity in all hospitals, and conducting new laboratory-based investigations, including seroepidemiology, viral tracking, and viral culture. The Medical Research Council plays a role through research, innovation, development, and technology transfer. And the scope of the Medical Research Council includes research and laboratory investigations, clinical research, and public health studies. It also publishes a weekly report on deaths in South Africa. In the context of the COVID-19 pandemic, Medical Research Council conducted a study on the excess death during this period. Their findings revealed that there may be additional deaths which are unaccounted for on the basis of the modeling which they have done. Various possible explanations are given for this phenomenon, such as people dying from COVID-19 before they get to the health services, or people dying of COVID-19 but death not being reported as such, or people dying from non-COVID-19 conditions because of constraint in the health services. It has also been acknowledged that there is uncertainty about these excess deaths. However, in comparison with other countries, as of 18th July, South Africa recorded 1.4% of deaths, which is comparable to countries like India, which is 2.5, and Russia at 1.5, but significantly lower than the UK, which is at 15.4%, and Spain at 10.9, and the US at 3.88. We'll continue to analyze this trend, but it is not unique to South Africa. We have urged all provinces to report deaths as guided by the WHO protocols so that they can be recorded and reported so soon as information becomes available, to avoid a backlog such as what we have seen in the Eastern Cape. This tends to create a confusing and concerning perception that there's underreporting of COVID-19 deaths, and sometimes it gives us an impression that there was a huge upsurge in mortality, when in fact it is something that's taken place over several days. The South African Health Products Regulatory Authority continues to play a pivotal role in the licensing and regulating of medicines and medical devices. We're pleased that SAHPRA has developed a detailed strategy to clear the inherited backlog, which is on track. We're aware that COVID-19 pandemic has caused SAHPRA to prioritize applications relating to COVID-19, such as laboratory tests and sanitizers, ventilators, and clinical trials. The department recognizes that certain cannabis-containing products have also proven medicinal to be of medicinal indication. In addition to that, the development of cannabis industry has a potential to be beneficial to the country's economic growth, including empowerment of small farmers. SAHPRA has also been involved in the development of the national framework for the growing and manufacturing and use of cannabis. We have recently also rescheduled cannabis-containing products, which now separates hemp, which is low THC-containing product, and with high levels of THC-containing products. Which we
Thank you, Honorable Minister. Thank you very much.
Thank you.
Unfortunately, the time is up, Honorable Minister.
Thank you.
The second speaker is the Honorable P.P. Janchi from the ANC.
Thank you, Honorable Chairperson of the session, Ministers and Deputy Ministers present, Chair of the Portfolio Committee and the members, Honorable members. Thank you for the opportunity to address you today. I would like to start my input by expressing a heartfelt condolences to the Mlangeni family and to all those who have lost their loved ones to COVID-19 in South Africa and in the world. I also would like to wish all those who are recuperating at home and in our facilities a speedy recovery. Honorable Chair, what remains important during these trying times is the need to cultivate the South African spirit of invincibility, to soldier on, especially in memory of Tatu Nelson Mandela. COVID-19 has created an opportunity for introspection as individuals, as the society, and those in the leadership, and we should all come together in the fight against this pandemic. This virus has stretched the resources in our country in a manner that is unprecedented. It has laid bare the inequalities in our healthcare system. It has also exposed the chronic underspending in our healthcare system and underfunding of health infrastructure. This experience also, Honorable Chairperson, teaches us to do more with the little resources that we have. I wish to take this opportunity, Honorable Chair and members, to commend the ANC-led government and its initiatives taken to flatten the curve of infection. One doesn't want to think what would have happened if these interventions were not done. We also note, Honorable Chairperson, the PPE supply chains have become severely constrained both globally as well as in South Africa. Limited imports and shortages of raw materials adversely affected local production. Through the generosity, as it was mentioned by the minister, made by South Africans, the Solidarity Fund was able to commit a total of 815 million towards procurement of urgently needed PPEs for South Africa. The country also received generous donations from different countries, foundations, and businesses. The strategy employed by National Department of Health in keeping with the World Health Organization guidance on actions to be taken during these interventions is commendable. Prioritizing national, provincial, and municipal level budgets to support the interventions that are set out by World Health Organization is also necessary for us to be able to tackle the pandemic. We do understand, Honorable Chair and members, that there is huge pressure on the fiscals to provide all the resources to tackling COVID-19 pandemic. We also want to commend the minister and the department for the close relationship that they've created with the private sector. In echoing these sentiments of the minister when he was addressing the University of Western Cape community, and I quote, "What we most deserve as a nation is to come out of this with a legacy of advancing the ideals of universal health coverage," close quote. And indeed, this pandemic, honorable members, has begun to put the building blocks for the national health insurance. We must look back and say, indeed, we have created strong relations that will lead to strengthening of our health systems. The ANC commends the initiatives undertaken by National Department of Health to increase its capacity in testing and tracing and to improve the turnaround time. Among the initiatives that the ANC-led government has pursued together with other countries on our continent is the groundbreaking Africa Medical Supplies Portal. This is a single continental marketplace where African countries can access critical medical supplies such as test kits from suppliers and manufacturers in Africa and around the world. And it is in the necessary quantities and at competitive prices. The platform will complement the work that is being done to ensure that the government has the medical equipment, personal protective equipment, and hospital facilities to manage the anticipated increase in COVID-19 patients. In closing, Honorable Chair, let me say that COVID-19 is the new normal that we're all waking up to in this country and many parts of the world. Let me echo the words of the President and the Minister of Health that we all need to take necessary precautions, wash and sanitize your hands, wear your mask, keep the social distance. This requires great patience, consistency, and perseverance. We have to choose as public representatives if we are going to be part of keeping the ship steady or help it tip over as the storm clouds grow. We have to encourage those around us to choose the collective path of saving lives.
Honorable Member.
The ANC wishes to express its unwavering support for the supplementary budget for the Department of Health. Thank you.
The next speaker on the line is the Honorable S. Gwakube.
Thank you, Chairperson. Chairperson, while we receive the grimmest daily news about the spread of the COVID-19 pandemic in the country, we must dare not lose sight of what is possible. South Africa can overcome this pandemic and form part of a group of countries who achieved the near impossible. We are able to save lives by implementing key interventions that will arrest the free fall that we have started to see happen in many parts of the country. It would be a mistake to throw in the towel now. There are pockets of excellence in our health system that we can turn to during these times. However, if we are to choose that path, we must do so immediately, as the window of opportunity is closing and closing very quickly. If we are to choose to prioritize saving lives over internal party politics, then the time to do so is now. The country's health system inadequacies are not insurmountable. However, they do require strong and decisive leadership. They do require agility and speed. They do require an honest reflection of what has been achieved in the past 4 months of lockdown. Our challenges require us to accept and deal with the fact that the past 2.5 decades of gross mismanagement and corruption by this government have compromised the health system and render it almost useless in the face of a global crisis. They require an admission that despite the commitment to build health system capacity across the country, provincial departments have failed to do so. Government must acknowledge that it did not build the requisite critical care bed capacity that will be needed or capacitate facilities with oxygen cylinders. It never filled critical posts or capacitated the NHLS for mass testing right at the beginning. It never secured a steady supply of PPE and ensured that systems were set up to prevent the kind of theft we are seeing in the provinces thus far. Once that admission is made, accountability then must be taken and urgent action must be taken to rectify the situation. The following must be provided or undertaken. Number one, field hospitals in key hotspots of the country must be completed at all costs in the next coming days. The Eastern Cape has only one functioning field hospital, which was donated to the provincial government. Facilities like Nazareth, through donations, have been able to function in part as field hospitals, but must have this capacity extended immediately to ease the burden on Gauteng facilities. The national database on bed capacity and availability must be made fully functional immediately. This guides healthcare workers in referring patients to where they are able to be assisted quickly. Critical posts must be filled and extra staffing capacity must be developed. It cannot be that ICUs are operating at a fraction of the number of staff that are needed. We must place the Eastern Cape under administration as per Section 100 of the Constitution. Recently, Minister Mkhize has stated to me that the crisis unfolding in the Eastern Cape does not require intervention provided for by the Constitution. Just yesterday, we learned that this province has not kept an accurate record of fatalities and reported over 400 deaths in one 24-hour period, a massive distortion of what is happening on the ground. Minister Mkhize keeps arguing that all provinces have required assistance at one point or another. This is the kind of denialism that is going to cost thousands of lives. The Eastern Cape health system has all but collapsed. Weekly visits, Minister, to the province will do nothing to rectify this. Strict national management of the province is needed. And lastly, the emulation of the Western Cape model where it is possible in other parts of the country. The Western Cape experienced the pandemic curve first. They began to institute some strong measures to deal with the gaps in the health system and have successfully managed to bring the number of daily infections down. This is something that must be celebrated and emulated. Key actors in this province can be seconded to other parts of the country to save lives. We cannot allow narrow political jostling to hamper life-saving measures. If these measures are implemented without further delay, we will see dramatic improvement to the country's response to the pandemic. In times like this, strong and courageous leadership is needed. That is the kind that will put aside political consideration for the sake of saving lives. However, the question now remains whether Minister Mkhize will rise to that occasion or not. Thank you, Chairperson.
Honorable Member, thank you very much. Thank you very much, Honorable Kwakuba. The next speaker is the Honorable Chirwa from the EFF.
Thank you, Chairperson. Greetings to the Commander-in-Chief of the EFF, Julius Sello Malema, the Deputy President, Nyeko Shivambu, all the officials, commanders, fighters, and ground forces of the EFF. We are once again burdened with the curse of begging the ANC to govern with integrity in the lead, whilst the priority at the center of their politics is to continue stealing from the poor. Minister Zweli Mkhize spent the first 2 months of this lockdown telling the whole country that our public health system was ready for the COVID-19 surge. However, through the instruction of my organization on the 23rd of June, I went to Procedural Hospital and learned that the mechanical ventilation of the hospital is non-functional and that persons under investigation and those who are confirmed cases of COVID-19 currently stay in one ward and in one area. I went to Stanza Wopape Clinic, which is one of the facilities that you piloted the NHI at. It is astonishing that the patients with injuries and those in critical condition are subjected to sitting outside because the clinic is too small. On the 20th of July, I went to Mamelodi West Clinic and was told by the staff and the management and the workers in Mamelodi West Clinic that they have taken salary cuts without ever being informed about it, nor with any justification, despite the fact that they are now even more overburdened because fellow nurses are falling sick in isolation and can't resume their work. There currently isn't even any HIV testing happening at Mamelodi West Clinic because the staff, personnel, and counselors were struck off. In this recent budget adjustment, you have decided to reduce funding from people with HIV a whopping 600 million, despite the warning from the World Health Organization that says 73 countries have already been affected adversely by COVID-19 in delivering ART, and that this will result in the doubling of AIDS-related deaths and an increase in infections. I also went to Tembisa Hospital and found that there's a shortage of ICU nurses. The hospital also registered a complaint that epicenters, namely Winnie Mandela and Ivory Park, call for great concern. The social factor contributing to the spread of the virus is literally space. Social distancing in these areas is impossible. Casualty and emergency wards are overwhelmed with suspected cases and persons under investigation. This means that there will be people who come with broken legs and leave Tembisa Hospital with coronavirus. I also conducted oversight at Chris Hani Baragwanath Hospital, the very hospital that Minister Zweli Mkhize used to brag about the readiness of COVID-19. In this hospital, there is a challenge with water shortage and assistance with reservoirs. Only 2 water reservoirs are currently in the hospital, which won't even last beyond 3 hours if there were to be a water cut. Furthermore, the parking lot is 30 minutes away from the hospital. Patients with disabilities, those in severe condition, those with respiratory challenges are expected to walk for 30 minutes inside the hospital to access the doors of the hospital. It has become apparent that the only reason why you have ignored the solutions given by the EFF week in and week out is because these solutions to you will mean less and less chances of stealing and seeing illnesses of the poor as a money-making scheme. We have long cited for district-based strategies as interventions with the help of demographics that include race being made public. This not only to track, respond to, and curb the spread, but to also start devising recovery strategies for millions of Black women and children who are always affected the most with picking up the pieces caused by catastrophic disease and the failure of the government intervention. This parliament must move towards implementing the proposed National Health Amendment Bill that was proposed by the EFF that will seek to ensure that every ward has a clinic that operates for 24 hours, open every day of the week. If this was done, our issues with overburdening of health facilities, lack of human resource and facilities, delivering primary healthcare and preventative measures, and thus our response to this pandemic today would have been less hopeless situation than what we are seeing right now. Besides the lack of leadership imminent in this department, our issue is that Lemahodu, you are blatant liars. People spent months on end resting on the assertion made by Minister William Kise that the public health system is ready, when this was far from the truth. Lemahodu, and you are liars. Thank you, Chairperson.
Order, Chair.
What's the point of order, honorable member? And who is that?
Honorable Chirwa must withdraw that Remahodu and they were liars.
On a point of order, Chair.
Honorable Chilese. I heard what Honorable Chirwa said, but she did not mention a name.
Exactly.
So we will not attribute that to a particular person.
What?
Thank you, honorable member.
The shoe fits, they can read it.
Hello.
Hello.
Yes, honorable members.
Yes.
Am I audible?
No.
Very well,
Yes,
Chair.
very clear.
The next speaker is the Honorable Shengwa from the IFP. Sorry,
Thank you,
there was a technical-
Chairperson.
Thank you, honorable
Thank
member.
you, House Chairperson, Honorable Minister, Honorable members. As we head deeper into the storm of the COVID-19 pandemic, now more than ever, we need to ensure our hospitals have detailed and transparent prevention strategies and are enforcing these accordingly. Before turning the supplementary budget of the Department of Health, the IFP wishes to stress its concern on report of the high rate of infection among healthcare workers, most especially in province of KwaZulu-Natal, especially at the Inkosi Albert Lutuli Hospital in Durban. We understand that the KwaZulu-Natal MEC for Health has recently established a personal health and safety committee at the hospital. This committee will apparently address this rise of infection and investigate challenges surrounding personal protective equipment protocols. The IFP will carefully monitor this situation to ensure transparency and accountability is upheld. We cannot risk the lives of our frontline healthcare workers who have been tirelessly fighting this pandemic. Honorable members, consideration of the supplementary budget of the Department of Health. The IFP is generally support the budget supplement adjustment. We understand that the need for funds was much higher than the 21.5 billion allocated to healthcare, and this places immense pressure on provincial health department to further prioritize their needs. The IFP, however, remains concerned about the ability of the provincial health departments to manage the impact of this pandemic. Our country can simply not afford any mismanagement or poor planning in the prevention of a treatment of this pandemic. It is critical that each provincial health department provides the detailed plan on how they will use allocation funds. This plan must be detailed and transparent. The IFP also urges the National Department of Health to ensure the province's business plan in this regard and made available for consideration. We cannot allow the waste of resources in managing of prevention, the further spread of this virus. In conclusion, honorable members, the IFP remains committed to monitoring expenditure carefully. We will not be passive bystander in the fight against COVID-19. The IFP support the budget. I thank you.
Thank you very much, honorable member. Thank you very much. And the next speaker is from the Freedom Front Plus, the Honorable Van Staden.
Chairperson, thank you very much. A caring government is a government who's always taking the need of the people by heart, who protects them, who looks after them, who cares for the elderly, provides education to his children, provides infrastructure and a sustainable economy, who do not allow corrupt activities in its ranks, who send the people to jail, who steal the taxpayers' money, and who provide sustainable healthcare to all its citizens regardless of class, race, gender, or color. The South African government, on the other hand, is not a caring government, but rather a government who failed to provide sustainable healthcare to its citizens. We have stood here many times and debated about the public health system, who first collapsed completely and now have passed away in the midst of a COVID-19 pandemic. We have stood here many times and debated the national health insurance. We have listened many times with shock to the president of this country who said COVID-19 is a genesis for the NHI and that the president is adamant to implement the NHI in South Africa. Still, we see every day the fear in the eyes of the people of South Africa when they need to visit a clinic, a provincial or a state hospital, the fear of not getting attended to, the fear of not getting any medicine, a bed or a doctor to help them, even when the clinic or hospital is functional. I fear, and the public fear, that the whole of South Africa's state hospitals and clinics are not ready for this pandemic, even after a lockdown on level 4 and 5. It is time to wake up. It is time that this government wake up and realize that due to their corruption and theft, due to their inability to provide sustainable healthcare services, they are locking people up with senseless regulations and causing the economy to come to a standstill. All of this because this government had not done its job to get the health system ready during level lockdown 5 and 4. You must wake up, really. Voorsitter, hierdie regering het veroorsaak dat die land 'n inkomste van nagenoeg 30 miljard rand verloor het weens die verbod op sigarette wat nie wetenskaplik bewys kan word dat dit bydra tot die nagevolge van COVID-19 nie. Met die drankverbod word daar gepoog om hospitale leeg te hou, maar weens die drankverbod het hierdie sektore alleen 'n verlies getoon van nagenoeg 11 miljard rand. 'n Totale inkomste vir die regering in hierdie twee sektore van nagenoeg 41 miljard rand is verlore en in die drein afgespoel sedert Maart vanjaar. Dink net hoeveel hospitale en klinieke kon met hierdie geld opgerig gewees het. Dink net hoeveel ekstra dokters en verpleegsters kon aangestel gewees het. Dink net hoeveel ekstra beddens en persoonlike beskermende toerusting kon aangekoop gewees het. Dink net die tonne suurstof wat aangekoop kon gewees het vir COVID-19 pasiënte. Dit is regtig die tyd om wakker te word. Voorsitter, maar in plaas daarvan dat hierdie regering aandag gee aan dit wat werklik saak maak en hulle werk begin doen, skiet hulle eerder op gesondheidswerkers in die Oos-Kaap wat bang is en net met die LER wil gaan praat het omrede hul lewens in gevaar stel, omrede daar nie genoeg beskermende drag is vir hulle om te dra wanneer hulle COVID-19 pasiënte moet behandel nie. Die Oos-Kaap blyk tans soos 'n oorlogsone. Gesondheidswerkers wat nie behoorlik op werk kan doen nie, omrede daar nie genoeg toerusting of mannekrag beskikbaar is nie. In steede daarvan dat hierdie regering sy werk doen, verskyn die Oos-Kaapse Departement van Gesondheid met nuttelose voorleggings vir die portefeulje komitee van gesondheid oor hoe hulle gesondheid in die provinsie gaan omkeer. Hulle kon egter nie aan ons sê of tydlyne verskaf van hierdie nuttelose planne nie. Nee, hulle wil eerder mense met ambulanse wat hulle nie het nie, net daai motorfietsies wat hulle het, aanry na die hospitale in die Oos-Kaap wat wel nog iets het om mee te werk. Hierdie is seker ook nou dan apartheid se skuld. Voorsitter, hierdie regering gee so baie om vir die mense van hierdie land, dat hulle in steede daarvan om daadwerklike pogings aan te wend om meer beddens, ventilators, suurstof, dokters, verpleegsters en veldhospitale in gereedheid te kry, hulle eerder daarop fokus om daar duisende graftes te grawe. In plaas daarvan dat hulle alles probeer om die welstand en gesondheid van die burgers van hierdie land te verseker en om te verseker dat hulle beskerm word en behandel word teen die virus, gaan grawe hulle eerder grafte. Dit is hoe hierdie regering omgee vir die Suid-Afrikaanse mense. Hulle koop nie hospitaalbeddens nie, hulle rig nie veldhospitale op nie, hulle koop nie suurstof nie, hulle spandeer nie hulle tyd om 'n teenmiddel teen hierdie pandemie te kry en saam met wetenskaplikes te werk om die wetenskaplikes te help nie. Nee, voorsitter, hulle gaan grawe grafte. Maar terwyl hulle die grafte grawe, weerhou hulle nog noodsaaklike inligting rondom hulle besluite van wetenskaplikes wat hulle van raad moet voorsien. Hierdie begroting gaan net weer beland in die sakke van korrupte amptenare en politici en ons gaan bitter min daarvan sien wat werklik 'n verskil gaan maak in die gemeenskappe van hierdie land se welstand en gesondheid. Hierdie regering kan nie vertrou word. Dankie voorsitter.
Thank you.
Hoor.
The next speaker is the Deputy Minister for Health.
Thank you very much, Honorable Chairperson. Greetings to the Minister of Health, my colleague, Dr. Selim Kise, members of the executive, the Chairperson of the Portfolio Committee, Dr. Sbonseni Jomo, and members of the committee, and all honorable members. Thank you very much for this opportunity to participate in this debate on the adjustment budget of Vote 18 for Department of Health, which follows on the supplementary budget, which was presented by Minister of Finance on the 24th of June, 2020. Honorable Chair and members, I wish to dedicate my input in this budget vote to our departed leader, our liberation hero, Istalwandwe Siaparangwe, and until the night of 21st of July, the only surviving Rivonia trialist, Comrade Andrew Miketi Mlangeni. We pass our condolences to his family and the entire ANC, the Congress movement, and the Alliance and his family. I also wish to pay tribute to the late Comrade Zinzi Mandela and all other compatriots who departed during this period of COVID-19 pandemic. I wish to take this opportunity on my behalf and that of the ministry to pass our condolences to families and friends of the 5,940 South Africans who until yesterday succumbed to the COVID-19 pandemic. Let me take this opportunity to thank His Excellency President Ramaphosa, my colleague Minister Mkhize, the entire cabinet and the National Coronavirus Command Council, and our provincial counterparts for the leadership in the fight against COVID-19. As we know, honorable members, the fight against COVID-19 is not just a South African one, but it's a global one. As reported by the WHO on the 21st of July, more than 14.5 million people have been infected in the world, and more than 607,000 have succumbed. Africa accounts for just over 600,000 infections, out of which our country accounts for more than 394,000. As of yesterday, the 22nd of July, our cumulative figure was 394,948, with the average daily increase over the last 7 to 10 days of between 10 and 13,000, with 229,000 people having recovered, and the total deaths just under 6,000 at 5,967. Our case fatality rate is still fairly low at 1.5% compared to the world just over 5%. As already stated by Minister Mkhize, we are indeed in the eye of the storm. The storm first descended on the Western Cape province, especially in the metro of Cape Town as the epicenter of the epicenter, sharing that status with its twin province, the Eastern Cape. But the storm has now moved like the cold front into the hinterland, now hitting our hub of the economy, the Gauteng province. In the process, no province is being spared, as we see rising numbers in KZN, in the Northwest, and even in the Northern Cape. The opening of the economy, the movement of people is leading to more spread, more flames, and potential fires all over the country. These rising infections put pressure on our health facilities, especially our hospitals, as there is need for more admissions of those who are seriously ill, some of them needing high care, and others putting pressure also on the ICU services. We have seen this pressure mounting in the Western Cape, especially in the Cape Metro, Khayelitsha Hospital, Tygerberg, Grooteskies. Similarly, we have seen the pressure rising in the Eastern Cape, Nelson Mandela, in the Buffalo City hospitals like Livingston, Doran Ginza, and other facilities in the Gauteng, Chris Hani, Tembisa, Charlotte Maxeke, Tshwane District Hospitals, George Mukari, and so on. All these facilities have been experiencing rising pressure. The rising storm is putting pressure on all our response systems. The testing capacity, as more people test positive, it means we must trace more contacts, test them, and make sure that those who are positive can put in quarantine. It puts pressure on laboratories, both in the public and private sector. Our public laboratory, the National Health Laboratory Services, has been increasing its capacity, but we must also acknowledge that private laboratories have also played a major role. As of yesterday, the total tests which had been performed were just over 2.5 million. 58% of the tests had been done in the private and 42% in the public sector. As more positive tests come through, it means we need more quarantine facilities for those who test positive, and also for the contacts who must be put under investigation. More positives needs more isolation, and also it means that for those who have minimum symptoms, but those who are sick, as I've mentioned, need to be admitted, and therefore that puts pressure. And therefore, indeed, this is why we appreciate the adjusted budget by the Cabinet and the Minister of Finance. And as we have mentioned before, during the level 5 and level 4 of the lockdowns, that gave us an opportunity to prepare for the peak. The last few months and weeks have taught us that the peak is not going to be just one huge wave, but it's going to be multiple waves across different parts of the country. While there is some plateauing in the Western Cape, the province is not out of the woods as yet, and as the storm now has moved into the hinterland. While we have laid the foundation for readiness of the storm, we have to adjust it we have to make adjustments as it hits different parts of the country. As I've already mentioned, the capacity of testing is improving, but we need to do more. We need to increase isolation, quarantine bed, but also readiness of the people to take up these facilities, because our experience in the Western Cape has been that while we, with the support of national government, we made sure that there is more facilities for isolation and quarantine. The uptake of this was not very good, as only at 15 to 20%, which does not help in curbing the spread of the infection. We have to increase the number of beds as more admissions come through. All provinces have identified either existing facilities which have been refurbished and expanded, but also additional field beds have been identified, and many of them are ready and already being utilized. High care and ICU facilities, also including oxygen supply and ICU beds, have also been made available. Emergency services also, to make sure that we can move people between the homes and clinics to high care facilities. Also, healthcare workforce. We've also, as already mentioned by the minister, had to hire more and more staff in our facilities. So this is why we appreciate the further input in terms of the adjustment budget. We're even more grateful that as far as the healthcare workforce is concerned, we have been also assisted by the Cuban Brigade, which has come very handy and has been deployed all over the country. in the communities and in our health facilities. In addition to that, Honorable Chair and members, it's very key that we as already Minister Mkiza mentioned, we've acquired a lot of personal protection equipment through procurement, but also through donations, because it is critical that we look after our health workers, because we are concerned also that as we hire more and more staff, other staff get infected and have to be laid off or be quarantined because of infection by COVID-19. As I conclude, Honorable Chair, we indeed welcome the adjusted budget, which will go a long way in terms of making sure that we can increase our capacity. We want to urge our people again to observe the basics, which are hand wash and sanitizing, wearing of masks whenever you leave your home, keep a social distance, avoid crowds, and stay at home as much as possible. And as I conclude, Honorable Chair, I want to say that we reject the continuous, pressure by the DA to say that their sister province, the Eastern Cape province, with whom they share a lot, not just geographically, but history, that province should be put under quarantine. We want to assert that the duty of all of us is to support each other. In the same way that as national government and National Department of Health, we supported and we still support the Western Cape to make sure that the people can, more lives can be saved. We will do the same thing as we're doing with the Eastern Cape and all other provinces. So indeed, we urge all members of the National Assembly to support the adjustment budget.
Thank you, Deputy Minister Joe Pasha. Doctor, thank you so much. Honorable members, the next speaker is the Honorable Sukers from the ACDP. And immediately thereafter, we're calling the next chairperson to take over, Honorable Mahambe Shala. Honorable Sukers.
Thank you, Chairperson. South Africa is in the 4th month of our national lockdown. The coronavirus, whether it originated in a lab or genetically evolved, has caused devastation to our economy. The only adequate response to this seismic moment in time is for equally strong and uncommon leadership response. Unfortunately, we have not yet arrived at the juncture where our overall responses meet the challenges with the same moral strength that is required to not only bring assurance, but also to minimize devastation to the lives of our people. The health budget has been allocated 58.4 billion, an increase of 5.2%. This allocation comes at the expense of other key programs within different government departments. For example, our basic education and tourism budgets have been adjusted downward to the amount of 3.6 billion and 1 billion respectively. The cost of this pandemic psychologically, socially is non-quantifiable, but financially every South African is paying a price. Our revenue loss over this period is projected by SARS to be around 285 billion rand, with the tourism industry facing total decimation if government does not urgently intervene. The Department of Health stands central to the response to this pandemic, and every dime and cent that is rediverted to strengthen the health system must be accounted for in infrastructure, equipment, services, and staff capacity. The misappropriation of funds, mismanagement, and irregular and wasteful expenditure during this period, and specifically in the health sector, should be criminally charged because of the impact it has on our people. Maleficence of any kind must be punished by law, whether direct or indirect action. Whether the failure to act in the best interest of the South African public by any health or government official, it must be met by swift and effective due process. Corruption steals from the poor, Chairperson. And in Africa, we say there is no curse without a cause. The causative effect of corruption on this country has become wicked. The ACDP, on behalf of every South African, regardless of color or political affiliation, is putting government on notice. The sacrifices that serve this budget increase, demand retribution for wrongdoing. Lastly, the ACDP wants to acknowledge the 50.6 million to primary health care, preventative measures for non-communicable diseases is implemented at the primary care level, and managing diseases such as diabetes and hypertension improves recovery from COVID-19 for patients who live with these diseases. It is important to note that the mortality rate for other diseases during this period, like HIV/AIDS,
it's not Sunday. Amen.
Thank you, Honorable Member. The time is up.
Thank you. Thank you, Chairperson.
Honorable Suma will come in. Honorable Suma, are you ready?
Yes, thank you, Honorable House Chair. That
Okay.
will I'll recognize Honorable Marau from the ATM. Honorable Marau.
Thank you very much, House Chair. Honorable members of this House, as the Department of Health is trying to manage the widespread of the coronavirus and the successful limitation of the number of possible fatalities that may be seen as a result of the continued spread of this virus, we should all be working collectively to assist the Department of Health educating the community as much as we possibly can to mitigate a potential disastrous outcome. ATM commends the Department of Health for all the strides that have been applied to date in ensuring that almost every South African is given the necessary treatment, care, and assistance during this period. It is equally important for the Department of Health to embark on community education campaign where we educate the communities on which herbs, traditional medicines, and plants to use in strengthening their immune system. Advice also on key foodstuffs to boost immune system should be an integral part of the COVID-19 toolkit. We have seen home remedies from survivors of coronavirus and have also seen warning from health experts warning citizens not to overdo these remedies. Yet the department is silent on bringing in traditional or homeopathic medicine experts such as Professor Nceba Gakeni of Virosad Botanics, a solution being scientifically proven to eradicate active and latent HIV and is showing promising results against the coronavirus. The solution is said to be backed by 14 years of scientific research at over 5 universities in South Africa, Canada, and Switzerland. It is the intellectual property of a South African medical practitioner. In the same light, Honorable House Chair, our solution should not only be on the immune system, but also on the management of the entire Department of Health, where we have seen irregular, fruitless, and wasteful expenditure being incurred in projects that do not benefit the people in any way. As an example, the failed scooter ambulance project in the Eastern Cape and the many irregular tenders awarded to suppliers during this time. Honorable Minister, the ATM call on you to lead the campaign to root out and bring to book corrupt workers of the department who deliberately steal or are involved in any irregularities on PPEs and other medical suppliers, which end up crippling the department even more. This is the time to have integrity, sound leadership, and patriotism. Put South Africa first and ensuring that we leave no citizens behind in this fight. We are saying, Honorable House Chair, all health facilities must be placed on high alert to ensure that all the strides taken as such facilities are supportive of the overall goal to not only successfully manage the coronavirus, but to also give the necessary attention to other patients who have been admitted for other illnesses and avoid a situation where we experience fatalities, especially in the maternity wards.
Honorable Member.
Insufficient
Thank
funds.
you very much, Honorable Member. Now I recognize Honorable Sheikh Imam. Honorable Sheikh Imam.
Thank you very much, House Chair, and thank you for the Minister and his team for actually in the presentation that they have made. Honorable Chair, allow me to start off by paying tribute to all the healthcare professionals who sacrificed their lives selflessly in the line of duty. And I hope someday soon, when all this is over, Honorable Chairperson, that in memory of these selfless healthcare workers, we can create a memorial site and put up plaques. The least I think we can do to give some solace to these families who have lost their loved ones. Now, let me start off, Honorable Chairperson. We are in a very, very difficult position. There is no doubt about that. We did not anticipate COVID-19. The health sector was already under tremendous pressure pre-COVID-19, but many of the problems have now been aggravated by COVID-19, and we need to deal with them. The additional budget, we don't really believe as the National Freedom Party is adequate for the health department to be able to deal with the challenges before. And one major concern for us is the implementation of the national health insurance, which is going to be delayed as a result of this. However, we want to say that the relationship that the public sector has built with the private sector, that the minister and his department must exploit that and see how they can best work together for the common good of the people on the ground by ensuring that the NHI is a win-win situation for the people on the ground. Now, one of the challenges that we have picked up, Honorable Chairperson, is the lack of communication with the people on the ground. And I must admit, even myself, it is so difficult to get assistance from the department when you get call after call of people expressing concerns on the ground where businesses are not complying, social distancing is a problem, masks are a problem. It's very, very difficult. And I think we need to create that environment where there can be closer communication and contact between us so that we can deal with the challenges that we have. One major problem I want to tell you, we know we're going to be have a shortage of beds and things. In KwaZulu-Natal, and particularly in Durban, there's an NGO that have repeatedly called, and we're getting so little help from the KZN Department of Health, where they want to provide these services with oxygen, with entire facilities at no cost to the state and no cost even to the patient, with professional doctors and everybody available. But the red tape appears to be so much of a problem. And the other thing we'd like the department to deal with is the issue, particularly of the levels of corruption when it comes to the PPEs in this time of need. We need to do a comprehensive exercise and look at every company that has provided PPEs in this country at all spheres of government and the prices that they have. And you're going to be shocked, Minister and Chairperson, at how much of money that has been taken away whilst we are fighting this pandemic. So it's a matter that I believe that we need. The other problem, and finally we have, is that the data that we used to get, we're not getting in terms of the age group of the death of the people and the provincial data on which provinces the lives that. If you look at yesterday's report, we did not get that. And I think it is important to give us a district and local level, each suburb, so people will know which are the hotspots and people can take greater measures there in terms of social distancing and masks and things. The National Freedom Party will support this adjustment budget. Thank you very much.
Thank you, Honorable Member. Now I recognize Honorable Sokaja from the ANC. Honorable Sokaja.
Thank you very much, Honorable House Chair. Honorable House Chair, let me take this opportunity and salute the Minister and salute the Deputy Minister, all ministers who are in the House and Deputy Ministers, and also the Chairperson of the Portfolio Committee and all honorable members. As the ANC House Chair, we want to extend our heartfelt condolences to the Mlangeni family and also the family of the Zinzi Mandela for their passing on. Our stalwart has passed on, and he is also the last Rivonia trialist, Comrade Andrew Mlangeni. May their revolutionary spirits rest in power. It was Baba Mlangeni who once said, I quote, criticism or not, there comes a time when bold steps have to be taken to ensure that transformation is realized. Society cannot be paralyzed by perennial caution because people's aspirations cannot be put on hold forever, close quote. And indeed, Honorable House Chair, the ANC remains committed to transforming the health system that had its roots in a set of apartheid welfare policies that were racially biased and skewed in the favor of the minority population. The transformation of the health system in South Africa has been and remains an urgent priority for the ANC-led democratic government since 1994. For well over 100 days now, Honorable House Chair, we have been living in the shadow of one of the greatest threats to global health in over 100 years. The ANC-led government has had to find a balance between saving lives and preserving livelihoods. The Department of Health has, from the onset of the outbreak of the COVID-19, undertaken intense programs to ensure that is combated. The
But we
department
can't see
issued.
this person. It's too dark.
Sorry?
The light, there's no lightning.
Let me just switch off the video. The department issued regulations in terms of the Disaster Management
Who's
Act,
presiding now?
which looked at the training, recruitment, and deployment of human resources, provision of health equipment, sanitation materials, and medical supplies, visitors from outside the country, etc. Services in the health system have been severely affected as a result of this pandemic. In an outbreak like this, it is important to not only focus on hospital care. General practitioners and family doctors have a vital role to play as well, which is precisely why the first step in tackling an outbreak like this is to protect our frontline staff. We wish to take our hats off to all the frontline workers who risk their lives on a daily basis in order to fight this invisible enemy. As the ANC, we are concerned with the surge in COVID-19 cases in the country, confronted by shortage of staff. The act is exacerbated by the rise in the number of infected healthcare workers and the shortage of PPEs and ICU beds in health facilities, and urge the department to ensure that protection of frontline workers is prioritized and that the ongoing issues are resolved. As the ANC, we are aware that the COVID-19 pandemic has exposed our healthcare system in numerous challenges. Honorable House Chair, the Portfolio Committee received a report from the Eastern Cape Project Management Unit deployed to support the province in its COVID-19 response. The committee expressed their dissatisfaction about the province's state of readiness. However, the committee appreciated the work achieved thus far, while noting that much more still needs to be done. The plans and the intervention presented lacked definite time frames, which also frustrated the committee. We are happy that the minister has acknowledged the challenges and weaknesses. As the committee, we are having full confidence in the minister and his team to assist as he has done so far in other provinces like in the Western Cape. In conclusion, Honorable House Chair, former President of the United Nations, Barack Obama, once said, I quote, "A budget is more than just a series of numbers on a page. It is an embodiment of our values," close quote. Indeed, this supplementary budget is a display of the resilience and perseverance of the South African spirit. It is on that notion that the ANC wishes to extend its support for this adjusted budget vote. I thank you, Honorable House Chair.
Thank you, Honorable Member. Now I recognize Honorable Hendricks from Al-Jama. Honorable Hendricks.
Thank you very much, Honorable Chair. Honorable Chair, Al-Jama will vote in favor of this budget, and we want to thank the Minister for his leadership. Honorable Chair, it is Al-Jama's position that field hospitals that arose as a result of COVID-19 should be rolled out all over the country, reaching everyone within reasonable walking distance. And this should be an interim measure to prepare us for the NHI rollout that is now becoming more and more urgent. Thank you very much, Honorable Chair.
Thank you, Honorable Member. Now I recognize Honorable
With
E.R.
the pleasure.
Wilson from the DA. Honorable Wilson.
Thank you, Chair. This health budget reads like a children's bedtime story. Lots of villains, very few heroes. Let's start with the Pied Piper, namely President Ramaphosa. He was sort of tuned for us, believed him, and agreed to follow him. He assured us the hard lockdown period would be used to improve the health sector to deal with the COVID pandemic. Sadly, with time, our president started to whistle off key and his promises were not kept. We found we were being led down the garden path. Instead of improving the already poor health sector, it was made worse in many instances. To improve the sector, it required taking what was already available, the casualties, the trauma units, the maternity ward, and the ICU departments, and adding onto them to ensure sufficient capacity to deal with the surge of COVID. Most provinces didn't get the message. Instead, they cut back on facilities already available and used those facilities for the COVID surge, putting the public at greater risk. In this budget, the department plays the fairy godmother and offers provinces 21 billion to assist with the outbreak. The horse has already bolted, Minister. The AG was damning in his report and was clear that the financial management of most provinces was disturbing, with no improvements made over the last several years. This has been apparent in the last months. The provinces have until the end of July to submit plans which have to be approved, and only then can be funding made available and plans actioned. Really, Minister? When the surge is already here and when they could not even make improvements in the first phase, where did that funding go? When lockdown restrictions were eased, people allowed to commute and purchase alcohol, hospitals found themselves under pressure. No plans were put in place to improve capacity or more doctors and health workers employed to prepare for the ease in the lockdowns. The plan failed. The president then blamed the public and introduced more restrictions to cover up this department's failure. In the Eastern Cape, we found the three blind mice, including the minister, who tried to convince us that motorbikes with a sidecar were Cinderella carriages fit for patients. There was no magic wand to fix Eastern Cape hospitals, where the conditions are abysmal. Doctors are collapsing as they become doctor, nurse, cleaner, porter, and caterer. Just yesterday, the Eastern Cape project team gave us a presentation on their readiness. They are not ready. In no way are they prepared. We were told to expect 9,000 unavoidable deaths as a result. There were 400 yesterday. Sleeping Beauty is still fast asleep. The new hospital at Bethel in Mpumalanga has come to a standstill with only 7 hours of electricity and the generator supplying the wards having been broken down for weeks. There is an inconsistent oxygen supply to wards as a result, and critical machinery is not working. In Limpopo, ambulances refuse to go out to assist trauma patients because of no PPE. In Lavubu, the clinic has suspended all services because the generator has not been repaired. Doctors with 1 year's experience are being employed as clinical heads. The KZN vacancies are left open for critical positions like surgeons and senior dietitians because applicants do not fulfill the BEEE criteria. Gauteng is a mess. The hero in this instance is the Western Cape. Not only did they improve their facilities, they established proper and functional field hospitals and prepared for the pandemic before the surge arrived. And of course, we must never forget our South African healthcare workers who have been at the forefront. We cannot put this country at further risk, nor can we see another cent wasted, Minister. We reject this budget. Thank you, Chair.
Thank you, Honorable Member. Now,
You're not audible, Chair. I think you have a network problem.
Yeah, I think it would be Honorable Jacobs now.
KL Jacob.
Honorable Jacobs, you can continue.
Thank you.
Honorable from the ANC.
Thank you, Honorable Chairperson. The ANC rises in support
Honorable
of the
Jacobs.
Thank you, Honorable Chairperson. The ANC rises in support of the adjustment budget of the National Department of Health. These are indeed very difficult times in the history of the world.
Unmute your mic, Honorable Member. Okay.
Can I start from scratch, Chair? I will start
Honorable
from
Member, you missed. We can hear you now. I think your voice now, his voice is audible now. You may proceed, Honorable Member.
Thank you very much, Chairperson. The ANC rises in support of the adjustment budget vote of the National Department of Health. These are indeed very difficult times in the history of the world. The coronavirus poses the same challenge wherever it spreads its infection. South Africa is affected in every way by the COVID pandemic, in much the same way as any other country. The coronavirus pandemic has made the world more attentive to the health of every person, and the health of every single person is supreme for that person and equates to having hope for the future. To quote a person named Thomas Carlyle, who said, an open quote, "He who has health has hope, and he who has hope has everything." Close quote. The intention of this adjusted budget is to attend to the health and the hope of all people of South Africa. South Africa's response is best captured in the words of its President Cyril Ramaphosa. The government is taking urgent and drastic measures to manage the disease, protect the people of our country, and reduce the impact of the virus on our society and on our economy. South Africa is not out of the woods, albeit we are only entering the woods now, and although forests generally are dark on the ground, we have seen South Africa be an example to the world. We managed to delay the rapid spread of the infection and extend the time before the surge to allow our healthcare system to be prepared, supported, and able to manage the number of persons infected with the virus. We have also managed to save many lives. That while our coronavirus numbers are growing at a high rate, our number of deaths per 100,000 is among the lowest in the world, even though we saw the announcement of 572 deaths nationally yesterday. And our recovery rate as a percentage of the number of infections is one of the highest at 58%. The infection numbers are rising in our country, and it necessitates us to be proactive, plan well and thoroughly, communicate with the public, and mobilize the appropriate response. This has been achieved very well by the South African government. The ANC supports the ministry and the NUH on its reaction to the pandemic. The adjustment budget as a response to the needs of our people is aligned with the objectives of the President and the National Coronavirus Council, with a net effect of increasing allocations to 3 programs, namely Program B, which is communicable and non-communicable diseases, with an increase of 3.1 billion rand to facilitate better management of the infection. Program 6, which is Health Systems Governance and Human Resources, with an increase of 108.9 million rand to improve staffing. And Program 4, Primary Healthcare, with an increase of 50.6 million rand to take services to the people at the coalface. The ANC also knows the allocation of 21 billion rand to provinces for the COVID response and has seen many interventions by the Minister of Health, juis om die burgers te beskerm, including the Western Cape, to assist provinces with the following, amongst others: by provincial financial planning towards a proper response to COVID, strengthening of health systems towards readiness for the surges, tracking, tracing, screening, and testing of contacts through the new ICT for COVID-19 program, provision of quarantine and isolation sites, field hospitals, treatment sites, high care, and ICU beds. deployment of the project management unit to the Eastern Cape to assist with the management of the challenges in the Eastern Cape. The Minister clearly explained the reasons for not putting the Eastern Cape under Section 100 administration at the Portfolio Committee on Health meeting yesterday, and we agree that the PMU was the best response, facilitating the support from the Cuban people in the form of the Cuban Medical Brigade, the members of which also serve in the Western Cape. The ANC also notes the awards from the revised national budget to health of 21.5 billion rand, 13.6 billion rand for frontline services such as COVID modeling and testing, and 40.8 billion rand for various grants to vulnerable households. It is important to note that the effort made now is improvements to the healthcare system, such as the healthcare system dashboard, patient registration, and the infrastructure, to name a few, will lend itself well to the implementation of the NHI. The ANC commends the ministry and the NDOH that despite the budgetary cuts, it works tirelessly to cushion the poor and most vulnerable members of society from the devastating effects of the COVID-19 pandemic. We wish to thank Honorable Gwagube for suggesting that we save lives over party politics. And at this time, we reach out to all political parties to work together towards saving lives and saving the livelihoods of our people. We require consolidated response by all South Africans and all people within our borders, and indeed in the SADC region and the entire Africa, to fight this pandemic. Finally, we want to say to all workers in the healthcare sector and other frontline workers that we notice and value your unselfish contribution to the fight against this pandemic. We also wish to extend well wishes and messages of support to all infected and affected in many ways, including losing family members and friends. We should all follow the public health regulations and stay safe. The ANC supports this adjusted budget. Thank you once again, Chairperson.
Thank you, Honorable Member. Now I recognize
Only Dr. Jacob.
Honorable the Minister.
Thank you very much, Honorable House Chairperson. Let me thank you as presiding officers, as well as the members who have debated this particular budget vote. Let me thank you for the support, some of the suggestions. And I also think that it's important for us to say on this matter of COVID-19, we must continue to work together as one team, as leadership of South Africa, and avoid the temptation to try and score political points. At this point also, I'd like us to, as we table this budget, to convey our condolences to the relatives, the families and friends of all those who have lost their lives in the fight against COVID-19. As my colleague, the Deputy Minister, Joe Pasha, has also done, would like to convey condolences to our leader, Isitshwala Ndwesi Parankwe, Comrade Andrew Mlangeni, as well as Comrade Zinzima Mandela. But I also want to pay tribute to Dr. Mamisa Ngiweni, whom we, in a few weeks ago, we named the VW Hospital in her honor for the good work she has done, who has passed away today. May their souls rest in peace. I also want to express our appreciation to all our health workers as individuals, as well as the trade unions who are working with us for all the work that they have done to raise the issues of the safety of our staff, as well as all the staff members, all our health workers for the work they've done. We appreciate the work they've done, their dedication, and their commitment to serving South Africa. Together with those, we also acknowledge the members of the military health services, as well as the Cuban Health Brigade, who have assisted us in fighting COVID-19. On a number of issues that you have raised, I think it's important to say that it was bound to happen that the weaknesses of our system will be tested by the onset of COVID-19. Even the best systems in the world have been stressed by COVID-19. But to think that we could have corrected all the weaknesses of the system within the 5 weeks of the lockdown, I think it was expecting a lot. We have done a lot that we needed to do to try and prepare our health services course, there will still be weaknesses, and we'll go around to different provinces to try and bolster those areas of weaknesses and ensure that we prepare the country for the ultimate surge as it comes. It's not a once-off event. We have to do this every day. And I want to say that, again, I reiterate that there are challenges in the Western Cape, in the Eastern Cape, in Gauteng, in KwaZulu-Natal, everywhere. And where there are challenges, we will be there. We will go and assist at that level. In fact, the Honorable Kwahube seems to have been counting only when I was visiting Eastern Cape. I've actually paid a lot of time visiting the Western Cape, Gauteng, and KwaZulu-Natal, and other provinces. So our approach is very even, and we always want to make sure we strengthen all the provinces. It's actually interesting. I think we need to be very cautious how much we comment about the figures in the Western Cape, as in relation to the figures as we stand today. Western Cape still has got the highest mortality, and we actually are learning as to what is going on in this COVID-19. Because a few weeks ago, the figures in the Western Cape showed a bit of a plateau, but that trend is also beginning to happen in the Eastern Cape. And in fact, the mortality there is a bit lower than in the Western Cape. What exactly is going on, I think is too much. If we politicize it, we're going to run into trouble. I think we leave the scientists. I've spoken to some of the professors to say, can we explain what is happening? It is clear that science will find out after the event what would have happened. So we are in the midst of the surge. We need to hold each other's hands and work together. But it is true that the issues of shortage of human resources are a challenge which we must work on, and we continue to employ the numbers that we can find available. We've removed all the bureaucracy, so all the procedures are shortened so that we can get as many people. We will expect that our professionals are going to move from province to province as the situation arises. Where I agree with all the members here is that we must fight corruption. There is no space for corruption, not in COVID-19, in the fight against COVID-19, not in the health services, not in any form of governance in South Africa, not in the whole country should we tolerate corruption. And I think on this one, we must all stand together to say there shall be a strong fight to resist corruption. And where there's enough information, we should be able to take action on those who are responsible. But that, in fact, we are improving our health services through COVID-19 so that it can be better able to handle national health insurance is a fact. Future national health insurance is, and if we don't learn from COVID-19 that we need to strengthen our health services and prepare for health service, never learn. So I think that just because there's no way that South Africa can survive anything in terms of health challenges without that. So at this point, Honorable House Chairperson, it would be remiss if I do not take responsibility to address South Africans about the responsibility that we must all carry as soldiers in the war against COVID-19. There's no conscriptions for this war, only consciousness. Every man, every woman, every child must be alive to the realities of COVID-19. We must understand that we're a product of our choices. We've made some tough decisions that brought us some success. With the choices we make in the coming weeks will be more important as we learn to work, socialize, and live along each other, each other's again. But we must, in a way, make sure the basic issues that will help us to contain the virus. Hand distancing, cough etiquette, those are very simple, basic measures that we need to adopt, but that is what will save South Africa as a nation.
Thank you, Honorable
From
Minister.
our point of view, we work together as we try to get our schools to open and our economy to open. Thank you very much, members, and thanks for all the support.
Long live the minister and long live the NHI.
Go see.
Mavovo.
Yeah, izwakale. Izwakale kahle.
I reminded that the
Amandla.
development budget
Tikware
goes
Chitona.
and environmental forestry
Awa,
and
boy,
Long live NHI.
Long live. Budget will take place as honorable members will continue. Honorable members will take place at 16:15 on the virtual platform.
Long live the
That
deputy
concludes the
minister.
debate
Long
and
live.
the business of this virtual
Long live
meeting.
Dr. Zobo.
The preliminary.
Long live Tilitsi.
Malam Nyai.
Sitanji.
Long live all.
Hello, sorry, procedural officers. I think you can admit people in. Yeah.